Hello and good morning, folks. My name is Lawrence Pepler, and I am the Senior Customer and Client Success Manager over here at chiropractic Practice Management Software. And today's a really super exciting day for us because, we do these webinars about once a month with a wonderful person and a group of people. Our special guest today is Kathy Kathy Widener, over at KMC University. Many of you may know her if you do any billing coding or you've been around the industry in the last 40 years, because Kathy's celebrating her 40th anniversary this year in the industry, helping people to code and bill and be compliant in coding and billing. She's been helping people for 40 years in our industry, so it's just amazing. But even more exciting than that, maybe equally exciting to that, is that today is a birthday. It's the birthday of our brand new series of cloud billing, chiropractic cloud billing, coding and compliance webinars. This is the maiden voyage of this webinar. And so in that vein, I just want to ask everybody, just be a little patient with this. We may have some technical difficulties along the way. You know how Murphy works when he's out there enforcing his laws. Again, my name is Lawrence Pepler. I'm the Client Success Manager over at chiropractic Software. I'm here with Kathy Widener. I'm the big technical difficulty this morning, apparently.
It's okay.
Kathy, how are you doing this morning?
I'm awesome. Thank you for having me. Looking forward to launching this new series for sure. I think we've got a good one for today.
Yeah, I think we do as well. And we're also honored to be joined by Felicity Sinclair, who is one of the subject matter experts when it comes to front-end usage in our new chiropractic cloud products. Felicity, how is your morning going?
It's going great. It's a terrific morning.
Every Tuesday is a terrific morning. You know why? Because it's not
not
Monday anymore.
Monday.
Exactly.
After being out all week.
So folks, I'm just going to go through, if you've never been in one of our webinars, the way that this is going to work. Kathy's going to do a presentation in the very beginning. It's going to take 20, maybe up to 30 minutes. I'd get your notepad out. I'd get your finger on your screen capture button that's going to be at the top of the GoToWebinar screen when we get there, because there's going to be some really good information there. There's going to be stuff that you're going to want to be able to hold on to, some of which may be available later in a handout, some of which may not be. So there is a screen capture button at the top of your GoToWebinar screen. So just get your finger ready, hit that button. If you ever need to do a screen capture, you'll have a little JPEG of that screen that you can save to your desktop and look at later. With that being said, there's also just going to be a little brief housekeeping. It may be a little bit less brief today, but I'm going to try to power through it just as quickly as I can. And what I mean by housekeeping is, well, we're just going to go over some things that are going to happen here today. So this is it. Today we're going to be talking on focusing on billing, coding, and compliance, making family care affordable for all. So it's all that information about setting up your fee schedules with respect to how best to care for kids, whether or not kids are eligible for care, things of that nature. So if you haven't already, you're not hearing me, but you should call into this phone number here and use this access code. You have two options for your audio experience today. One of which at this point in time is probably just to hit mute that guy, but it's okay. We're going to get through this. There's the computer option and there is the phone option. The phone option is always going to work better, just because it's only dependent on your phone line. Your computer's option is going to be dependent on your computer, which we all know is computers that they just kind of do what they want to do sometimes. So we'll talk about that again briefly in just a second. But hey, let's talk about somebody who's been helping people in our industry for about 40 years, for almost now like 40 years in a couple of weeks. Kathy has the boldest, best, brightest, and keenest and cleverest mind when it comes to billing, coding, and compliance in our industry. And her team is impeccable. If you're a ChiroTouch member, you're a ChiroTouch user and you want to become a member, I know they offer a pretty cool discount for you. This is her contact information. This is her team's contact information. Grab a screenshot of that if you're interested in their services. I'm going to throw a poll up a little bit later. If you are interested in their services, you just say yes, and we'll have somebody over there reach out to you. I would talk about this all day because I know there's so many accolades we could add to it, but we're just running a little bit late. So
and
that housekeeping,
don't.
I was. Kathy hates it when I love it. Well, she doesn't hate it because she's not a hater, but she gets yep, she's very modest. We'll just put it that way when I throw love at her. So here's the housekeeping part. You know, like I said, if you're not hearing me by now, I'm guessing you're using your computer or you don't know how to use a phone. And there's something, and if you are using your computer, there's something wrong with it. I hope you're seeing this screen because you can then dial into this number that's going to be your best audio experience. How are you going to communicate with us today, folks? Well, you're all on mute because, well, you're a lot of you. And we don't want everybody talking over one another. And we want to be fair and we want to make sure that everybody gets their questions answered. So we want to get those questions sent over to us in the little questions interface field that's at the box that's at the bottom of your GoToWebinar toolbar. If you type a question into that box, it comes over to all three of us. It also gets recorded in perpetuity, so we can come back to it later and follow up with you via email should we not be able to answer that question. This is how you're going to communicate with us. So if at any point in time you have a question, type it in the box. If it comes to your mind, type it in there. We'll get to it, I hope, before the end of the session. We may feed an answer back to you in written script. We may read your question live. Lots of questions come in, so we can't read them all live, but we'll get to some of them, I can tell you that. Anything beyond that, just read the first three things on this PowerPoint slide. Technical difficulties, hit that Citrix support page option in that box. It's rare that there are, but there might be. Now, we already kind of went what we're going to cover today, so we're just going to jump into it. Now, after Kathy's done, we're going to have an open Q&A session where everybody can ask questions about what's topical to today's webinar. This is not a how to use ChiroTouch webinar. This is a how to get the most out of your billing, your coding, and making family care affordable to all. And then, of course, there's some experiential crossover because in order to do that, you're going to have to use your ChiroTouch software. I just want to get that out there, manage everybody's expectations. This is not a training webinar on how to use the ChiroTouch Cloud, although you'll see it being used today. So here we go. That's enough from me. I am going to throw it over to you, Kathy. And by golly, folks, we are very fortunate to be here today. And I thank you for coming.
All right, let's roll. We got a lot to cover and we're short on time, so I'm going to go pretty quickly here. As Lawrence said, you are welcome to ask questions on any topic you want to, but please don't add your questions into the panel about this topic until it's done. And then we have Felicity here. If there's something specific about the interface into the cloud, she'll be able to talk a little bit more about that. So we're going to talk about family care. This is very much a compliance issue because we're talking specifically about finances, and it is one of the 4 areas that the Office of Inspector General, kind of the oversight in healthcare for legal and all of that stuff, it has told us that we have to be careful. So many practices want to help more children, help families, and then they're trying to do the right thing, but they do it the wrong way. So I want to give you a little education on the topic today, and then talk about how you could do it properly or do it within the rules.
Hey, Kathy.
So, yeah. Yes.
Let me just say one thing that I forgot to say. Folks, this is being recorded. It will be present on the ChiroTouch community within 24 hours of its presentation. Absolutely is being recorded. I'm sorry, I had about 17 people ask, is this being recorded? Because that's the most important thing I needed to say when I was doing my housekeeping and I forgot to say it. This absolutely is being recorded. Everybody will have a chance to watch it later. There'll be links on the CT community. Thank you, Kathy.
You are welcome. And so you really do have to understand that we're in the 3rd most highly regulated industry in the country. And sometimes we think we're the same as the McDonald's down the road and we don't have rules to follow, but we do. And because the provider is licensed, it even adds another layer of rules. So we know that the risks that the OIG has told us about are these kind of 4 things. So very often in these every other month webinars that we do, we talk about it's work within your software and why these things are red flags and what to do about them. So today our focus is on this one, which is patient financial inconsistencies. And because we're focusing on families and children, we want to make sure you kind of ask the right questions and come at it in the right way when you do so, and understand that medical necessity for children in chiropractic can be very different than medical necessity for others. And if you wish to offer any type of legal discounts, there is a way to do it. So hopefully you're familiar with Clinical Compass. CCGPP is the Council for Clinical Guidelines and Practice Parameters. There's a lot of really great research and information there for chiropractic. They are kind of the research arm of the profession, if you will. And they did some really interesting work relative to evidence that children benefit from chiropractic care and can indeed have coverage under certain insurances, and they've gone to bat on different things as well. So in one of these references, you can kind of see all of these things that are available for you to read, especially if you're the provider on this call today, and understanding the types of things that you may be able to do. So we can have all the care that you might decide to render to children is absolutely clinically appropriate if within the scope of practice in the state, but it may not meet with the policy of the payer that you're billing, because that payer policy will always be dictated by the contract the provider signed, as well as the medical review policy they've stated. I'm going to show you some examples here. So very often in these contracts, we will see words like experimental, unproven, investigational. Many insurance companies will say, for example, that active release technique for anyone, not just children, that Graston technique, that certainly wobble chairs and all of those things, which goes without saying, are considered experimental and unproven. Specific details in most every medical review policy will relate to the care of children. 99 times out of 100, what you're going to find there is that if there is going to be a limitation on insurance coverage for children, it's going to be for non-musculoskeletal conditions. So they'll say, you can't have a diagnosis of asthma. I can tell you that chiropractic care 100% affects asthma. It solved my asthma, as you know, almost 40 years ago now. But we follow the rules of the payer that we're dealing with. So you have to go know what to do. And here's a great example. Aetna, in their chiropractic medical review policy, indicates there's insufficient evidence to support the use of chiropractic in non-neuromusculoskeletal conditions in children. Frankly, same in adults. But it's important that you know when you start to understand about enuresis and otitis media and colic and these things that we know make a difference in those children or adults for that matter. If the payer doesn't cover that diagnosis, that's not going to be covered. Is there something else that could happen? Of course, and I'll talk to you a bit about that. So whether you are participating with the plan or non-participating, you're expected to know the rules. The best way to find the medical review policy for a payer is A, if you're in their portal, you can access it pretty simply, or go to Google, search chiropractic, search the payer that you're looking for, and you will ultimately get to that place if they have MRP for that particular instance. Now, if you do happen to be a KMC University member and you're using our customizable verification forms, this one is one for commercial insurance, you can see that we always give you space down in that section 6, that other section. And we encourage, if you do have a large family practice or delight in taking care of children, that perhaps you add these questions to your verification, because you can customize those and then print it off as a new master. One of the biggest issues is understanding those covered diagnosis codes. And as we say, if you're treating or co-treating for any neuromusculoskeletal condition, always code the neuromusculoskeletal condition first, such as the cervicalgia, lumbalgia, any algia related type thing. You can also simply use a segmental dysfunction. Short-term limited care lends itself to these types of diagnoses. They don't really work well when you're trying to treat longer than 8 to 10, maybe 12 visits, but for a child, you're not going to treat them that long anyway. So chances are these will be just fine, and they are musculoskeletal. So the good news is that even if you know that your ulterior motive is that cervicalgia that the little kid has ultimately is related to the ear infections, we're not going to say we're treating the ear infections. It could certainly be in the history, but it is not necessarily going to be your primary diagnosis. Now, We know that that's the way that we can work harder to make sure that any care for children is indeed covered. But what if it's not? What are your options around your discounting or other things of that nature? So we know, we're going to go back to kind of a primer lesson on this. A typical chiropractic fee system looks like a rainbow. We have the actual fees. We have any contracted fees that you have agreed to by contract with commercial payers, in some cases even Medicare Part C payers. There are regulated fees like Medicare adjustments, like VA, like Medicaid, workers' comp, things of that nature. And then you may have a professional courtesy fee schedule. You may have a hardship fee schedule. But in order to really dig in and understand, we have to know that we're doing our fee system properly to then know how we can legally discount if we decide to do that. So I like to divide it into these sort of either ors. We know we have actual fees and discounted fees. There are no other types of fees in your practice. And all discounted fees are derived from your actual fee. So it's incorrect to tell a patient, my cash fee is X. And if you're doing that, I urge you to stop immediately, because you're confusing the patient and you're also misrepresenting the legality of what you're doing. Our regular fee for an adjustment is $55. You qualify for our Blue Cross Blue Shield fee schedule because you're a Blue Cross Blue Shield member, and therefore the allowed fee for you is $40. So never shy away from your actual fees. If people don't know what those are, then it looks shady. It looks unseemly. So let's look into the discounts. Again, either or. You have either those imposed upon you or those which are elective. And imposed discounts really are going to relate to those things that are contracted or regulated. So let's talk the regulated first. In your state, if you have no fault or PIP, that's a fee schedule. It is what it is. Medicaid, the CMTs in Medicare, workers' comp, VA, the fee is the fee, and if you accept that patient, you accept that fee. So I get pushback sometimes when teaching, where someone will say, well, that's a dual fee schedule. No, it is not. It is an actual fee that this patient qualifies for. Because they're workers' comp, I have to accept that fee schedule. Now, contracted fees are only involved if you indeed are in network with the payer you're billing. If I'm out of network with the payer, Aetna can tell me I'm only going to cover $30 on this, but it doesn't matter. I'm charging $55. Aetna may pay $30 toward that, but the patient owes the other $25 because I represented my actual fee to that payer. I'm out of network. That's the game I'm playing here, and therefore I have to follow those rules, which means the patient owes every penny up to the amount that I billed. This is all should not be brand new to anyone here unless you're brand new to the job. These are basics. This is how the world works. So contracted fees, we don't really get to go negotiate. Literally had a doctor call me yesterday, had called while I was at Parker Vegas last week. I left a message and said, hey, I heard that you can help me negotiate with an insurance company to get a better contracted rate. I said, oh, you are misinformed, my love. I cannot do that. There are certain instances where you have some leverage, but usually it's not going to be possible. Therefore, it's on the imposed side. Now, the good news is you have all this room over here to make some elective discounts. And these are the elective discounts that we would normally see. So again, discounted fees, imposed, remember these are those, and then regulated is not a violation. Let's recap there. And your contracted discounts. Now, if we look at the contracted discount piece here, if these are made up numbers, so don't think I'm telling you what to charge, if indeed we are with Blue Cross, let's say, as an example, these services, when $350 from my actual fee, are actually $220 and $185 down to $95 because I've agreed to this by contract. I don't get to have this money. It's a write-off, and that's a specific write-off in the system. Now, let's dig into the elective discounts because we know what's been imposed, but what choices do we have over here? We know that unless you're in one of about 3 different states in the country, the government's national sort of guidance around what reasonable time of service discount looks like, or bookkeeping savings, or whatever other name you want to call it. What's reasonable is maybe 5 to 15% off your actual fee. Remember, all discounts come from your actual fee. So if my charge is 50, and I'm going to make it easy math for me on the fly here and call it 10%, I could take $5 off if someone's paying me at the time of service. Now, I don't think that's super helpful, not if I'm coming 3 times a week and have no insurance, but there's options. It may be that if you're in North Carolina, for example, you know that the North Carolina board has said that up to 30% might be reasonable for non-federally insured patients. So I could do a 30% off if I'm in North Carolina. Minnesota, Colorado have rules, but they're not telling you how much. Still very scary. Nothing stops you from having a financial hardship discount, properly documented, properly verified, and written in your policy. It's not willy-nilly. Everybody who walks through the door doesn't have financial hardship, but there's rules associated with it that are really, quite frankly, very simple. You just have to follow those basic rules. And in so doing, financial hardship is a very valid thing. It can even work for Medicare patients. Medicare would much rather that you allow someone to pay $5 a week toward their balance until their balance is zero than to just write something off and say they can't afford it. So there are rules that go along with it, but you have a really great tool in your tool belt with financial hardship when this happens. I can remember in one of the practices I worked in Arizona, the doctor took care of a ton of families. And I happened to live in an area that was very common to have a lot of very, very large families, 5 to 9 children, as you know, as well as the parents. And so there was a legitimate financial hardship if the children needed to be checked. And so it was possible to have them qualify for the financial hardship discount. We run our financial hardship kind of guidelines and forms and whatnot within KMC University off of the federal poverty guidelines. And the federal poverty guidelines will go, for this many people in the family, this is what is deemed to be reasonable. So it is an easy way to do it, and it's a very verifiable way to do it. Professional courtesy is something that everyone should have policy on in their practice. If you as a staff member are taken care of at no cost by your provider, then you better have a professional courtesy policy in place. Because what happens is things go sideways when maybe there is insurance or there is an accident involved or something. So professional courtesy are all of those courteous discounts that the doctor does for family, for staff, for fellow doctors, and you better have that elective discount well documented. If you don't, then I urge you to seek some help to get that brought up to speed, because it can be the domino that sends down all the rest of the dominoes if you don't do that just right. And my favorite way to discount, legal, clean, is by utilizing a discount medical plan. And we'll talk just very quickly about how that works. So we know our rainbow here. I love ChiroHealth USA. It happens to be the one that gives the most money back into the profession, supports research, supports the state associations, and it is a legal network in every state except Washington State. If you're in Washington State, you're hosed, unfortunately. Your insurance commissioner has elected not to allow any discount medical plans there. So you have to look for other options, but the rest of the 49 states, this is my preferred option for many, many reasons, not the least of which is you get to decide for yourself what those discounts look like, and you can do a legal family plan discount within it. For example, if my actual fee for most patients is, let's just say this is a normal first visit, $350. I could elect on initial visit under ChiroHealth USA to set my fee at $150. I could do that if that makes sense financially and it's what I want to do. But if I do not explain it properly, meaning Mrs. Jones, today, Dr. Pepler provided the exam. We did these 2 sets of x-rays. He got you adjusted as well as that electric muscle stim to address your pain. The total for today is $350. By any chance, are you a member of one of those discount medical plans? I know you don't have insurance. No. Well, let me tell you, we are a member of one called ChiroHealth USA. If you were a member of that plan, I could legally discount this visit from $350 to $150 because that's the set fee for members of that plan, just like I have a set fee for Blue Cross members or Aetna members. Now, it is $49 to join. That covers you and your family for an entire year. I think that if we could go ahead and get you signed up for that today, then I could legally go ahead and offer that $150 today. Now, even at $199, which would be the total with that, you're still way better off than $350. Which sounds better to you? Now, anyone with a pulse is going to say, of course, I want to do it that way, because not only have they now joined and now they and their family are entitled to discounts in my office, it goes for a whole year, which is fantastic. Same would happen on routine visits. And if I elected, I could set a capped fee where they pay no more than a certain amount, or I could have a la carte discounts, such as I might have for Medicare patients. Since Medicare patients are partially insured, this allows me the opportunity to say, if the only thing that we're having today that comes out of pocket, because it's only for cash paying patients, and remember, Medicare is paying cash for everything that is not the spinal adjustment when the spinal adjustment is medically necessary, I can have this type of a la carte pricing, and I can still have a professional courtesy fee, and I can still have a hardship fee. So I love that it does that. And what makes it legal is that the provider is joining this network, which costs them nothing to credential or join. And all of the legalities apply the same way that these legalities apply, which is fantastic. So it is a very viable option. And I want to show you how it becomes a very viable option for your cash paying patients who have families. So what I love is that it kind of straddles the contracted discount, although you're setting your own fee, while setting your own fee on the elective side. So you're protected by contract, but you're discounting by choice. So what you can do with their fee schedule, and this is something that we do when we do a fee analysis, we can help someone set up all of these fees, look at what you have, look at your costs to deliver your services, make sure you're not, your fees are in line with your area and all of that. But you have the ability to not only set your fee for the first person that comes in, but then if you wish to have a second or any subsequent family member get perhaps a higher discount or a different maximum fee, all the way down through as far as you'd like to go, in addition to those routine office visits. Now, one of the things I like to do when I'm working with a practice to set this up, this is an example of what you could do. First of all, is you could have that initial visit cap of $150 as our example showed. Maybe the second family member that comes in, it's $100. It's not $150. And you could have a third if desired. And then for your routine visit, $50 for the first, maybe $25 for each one, and so on. But what I love to see happen is oftentimes families will want to say, we take care of babies for free until they're 12 months old. That can be written into this. If you never bill any insurance and you never bill any car accident or anything like that, free is free is free. No problem. You don't even need CHUSA for that. But if you wanted to say all children under 13 are $15 or something like that, and I usually will counsel a practice, look, you could get a 16-year-old driving himself to the practice. He's a lineman on the football team and he weighs 250 pounds. That's an adult, baby. You don't necessarily want to, you're going to work just as hard on something like that. But you make your choices, and you could have a sliding scale for those children if you wish to. So there are many, many ways that you can do it. Under 18, under 12, whatever it may be. And you have many, many, many choices of ways that you can do that. And as we wrap up, a couple of things that I'd love to talk about, and I don't see any questions, but I hope you'll start putting them in now, is what are you doing now, and how do we clean that up? How can I support you in getting that into more of a clean sort of a model for taking care of families. So, you know, this is a safe space. Feel free to put in the question what you're doing, and I'm happy to visit with you about it. You have me, you know, for the remainder of the hour, so you might as well use this wonderful thing that Chiro Health has provided for you. Chiro Touch has provided for you. Lots of chiros here. But remember, you're free to choose. You can do what you want. You can make your choices. You can choose your level of risk, but you are not free from the consequence of your choice. So it would be important to make sure that as you're making those choices, and trust me, I talk to people all the time who are like, well, I mean, I want to do that, but I don't want to do it all the way. What are my options? Well, your options are I'm not your mother, you're in charge, but you have to be willing to get the best advice you can from a compliance specialist and then make that decision for yourself. And what we're going to do in our downloads is I've provided the notes for you today, and I've also provided this kind of cheat sheet about what we talked about with actual versus discount, imposed versus elective, and that kind of thing. So I'm going to leave this QR code here for just a minute and let you scan it, or else just copy down the URL there. And when you go there, just give up a little bit of information there, and then the download is right there. And I included, as I say, the slides today for you in case you're a CA that's here and your doctor's not here for some reason and you want to go back and visit, or you're the doctor and your CA's not here. Super happy to visit about that. And then we also have a great offer where we don't really do this all the time, but we are offering a 2-week free trial to our library. And in just a moment or two after everyone's had a chance with this, I'll put that other QR code up. I believe it is also going to be right on this same download page as an opportunity for you. So my staff tends to do a good job of making that easy for you to understand. And Lawrence, I'm happy to dive into these questions while they're doing that, if that works for you.
Absolutely. I'll tell you what, you want to catch your breath for a second. I just wanted to tell folks, CHUSA is an awesome service. This is just, there's so many people out there saving or making and saving tons of money on CHUSA. And then I was going to say, hey, there should be a screenshot button on your screen. So even if you don't want to, like if you haven't had a chance to, you don't have your phone on you, you don't have a way of scanning that code right now, just go ahead and hit that screenshot button, save that picture to your desktop. You can go ahead and come back and scan it at any time. With that being said, if you're ready to go, want to give you a chance to just wet your maybe
I did
sip some water, and all right, you're on fire. Let's let her roll. I'm not gonna get in the way.
The question from Jenny was, could a Medicaid patient use Chiro Health USA for discounts if we're out of network? So if you are not participating with your Medicaid plan and they are not a QMB, meaning that their primary is Medicare, they can absolutely join Chiro Health USA. Why? Because it applies to any cash paying patient. And if you're out of network with Medicaid, that patient would be cash. So that's kind of how we manage that. And Valerie is asking about the S8990 code. So remember back on our slide where we talked about the a la cartes, for example, relative to the Medicare, you know, I only want to charge $10 for modalities and like that. That comes out of a section of that CHUSA fee schedule that's section 2C. And one of the options there is to set your maintenance code for non-Medicare people. Never use it for Medicare, Valerie, but S8990 can work just fine there. So for example, if you always, let's pretend that your S8990 is, you know, for maintenance is $40, but if they're a CHUSA member, you want it to be $30. That's totally fine. Then we would just set that up as an a la carte code that CHUSA members would qualify for that $30 instead. Carrie, unfortunately, if you did a 2-week trial, they're not allowing a second 2-week trial. If there were extenuating circumstances as to why you were not able to partake of it, I urge you to reach in and to talk to Marty and tell him what happened and ask him if he would afford you another opportunity. I think that we are generally fairly reasonable people. So definitely you make the call to us, ask for Marty, tell him what happened and that you would like to be afforded another opportunity. He can set it up for you. You don't even need that code. Stephanie, if you'd like to visit with me. Certainly, I will place my direct information there. You can contact us directly and we'll be happy to visit with that. John is asking if he can discount co-payments for a family who has insurance. So unfortunately, co-payments are a contract between the patient and their insurance company, that they are expected to pay that portion before the insurance will pay their portion. So you are not a third party to that conversation. Now, what you are a third party to is the agreement between you and your patient. So rather than discounting that, what I would like to invite you to consider is to maybe do a quick consultation with us, because it would not be something I'd talk about publicly, but there are ways. Remember, if you've been on these before, you know we talk about charge correctly, bill correctly, collect according to your policies. While you can't discount the copayment itself, there are ways that you can make the payment affordable. And I would be delighted to visit more about that with you privately. Amber says that we offer a time of service discount for all uninsured patients. Our adjustment is $40. We give a $10 discount. So a $10 discount is a 25% discount, Amber, and it may be deemed to be more than is reasonable, but there are a lot of other circumstances that kind of come along with that. So, for example, if you did more than just the adjustment, say you're doing some therapies, or it's the date that they're having a reevaluation or something else is done, and that is not discount, but the adjustment is, you know, then you're looking at some other issues there. So 25% is more than we would normally expect to see. There are clean and legal ways to do it. For example, if you were a member of ChiroHealth USA, you could do that all day long. That would be very simple to do. Happy to visit offline with you about that if you would also like to do that. What was the more dramatic change that took place in billing in 2023? I heard this stated, and I'm new to billing. There were no dramatic changes that I'm aware of. There was a very, very, very minor change to the E&M codes that went into effect in January. In 2022, we had the No Surprises Act. That was a major change, but by now you should be golden with doing a good faith estimate for all of your cash paying patients and anyone not using their insurance. You might go back to the person who told it to you and ask them to clarify. I would say that there are very few people on the planet more in tune with what's going on with chiropractic billing than we are. And if we don't know about it, or it is something different, then we could certainly visit with you privately about that. It looks like maybe Felicity might be the better person to answer Carrie's question.
I agree with that. Felicity?
Hi, yes. Hi, Carrie. This is Felicity. No, that's not needed each time you enter that information in.
Good to know.
Yeah.
All right, Valerie's back. I have a question about new services that are only cash services and are non-covered by insurance. Is there any problem with offering tiered pay plans for something like, sorry, I lost my, if you could clarify what the initials ESWT means. I've never heard of that in 40 years, and maybe I'm just dense today. Oh, shockwave, okay, yeah. So the most important thing to know is that if you participate with an insurance company and you're going to do a service that is experimental, unproven, and investigational, as Shockwave is, you must make sure to get an acknowledgement to self-pay from the patient. Sometimes the payer has their own form, and you've got to go find out if they want it on their form first. The patient has to acknowledge they want it, and they'll pay for it. You absolutely must do that. Then I can answer the second part of your question here, which is assuming you've done all those things and you wish to offer a package. A lot of people like to do packages, like with laser or decompression or things that are never, 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 ever billed to insurance. You can absolutely do that. And there are clean and legal ways to do tiered pay plans. Now, if it's something other than a package, I'd have to talk to you personally about it, but I'd be happy to do that if you have those additional questions. Generally, it's going to simply be an add-on. So most time package, you could do that. Just be very careful because it's one of those things that's on the border because it's always cash and it's not meant to be an incentive. Those are the options. So depends on what you're going to discount. If I pay in full up front, how much do I get off, or do I get 1 or 2 free treatments? If I make 2 or 3 payments, what is the incentive there? It boils down to that. Make sure also that you're careful about ever doing that for any federally insured patient not using their insurance. So even Medicare, since it would be considered excluded under Medicare. Packages, you have a little more wiggle room, if you will. A little bit more wiggle room. So one of the things we thought we would talk about briefly here, Felicity, if you are interested in sharing this, is if I do have a ChiroHealth USA fee schedule and I want to put that fee schedule into my ChiroTouch so that I can assign a patient to that fee schedule and move forward in that fashion. Is that something you could maybe show them how they might do that?
Yes, definitely can show that to you all.
And so Felicity, I just sent over the, should be asking you right now if you want to show your screen.
Yes.
And if you don't see it, it's likely behind one of the, oh, there you go. Yeah, there you go. Awesome.
Alrighty. Yes. So if you're wanting to add a ChiroHealth fee schedule, so in your settings here, I had a few testers in here. You would go to your billing settings, and it would be it's called pay your fee schedule, but you can also use it for other things other than just your pay your fee schedule. For the ChiroHealth, you would just add. You could name it ChiroHealth or whatever you want to name it. And then, you know, according to all of the different fee schedules that she mentioned today, you could do fee for service, where you have a discounted rate, where you would put in whatever charges would apply to that, all of your 9(8), you know, these charges that may relate to it that you have in the system. You can add all of those charges or any other charges that relate to this. You want to make sure you put in the proper adjustment codes for it, and then you can put in the fee schedule charge that you want there.
And let me
Also,
can I just add a piece there? The adjustment code, if that's going to actually show up later when you're doing your analysis of what you've done or what you've written off, I would encourage you to create one that's called CHUSA discount. But the truth is that if I put the fee schedule in here at that fee schedule, and Felicity, could they put a capped fee as one of the line items if they chose?
you could create a capitated fee schedule. We
Yeah.
have that. That's what's available for the CHUSA. I think this is a better one for the CHUSA, is the
But
capitated fee schedule.
it can't be a mixture because most people have capitated for the initial or the subsequent visit, but they might have those a la carte fees as well to put in. Could they do both?
If they not with the capitated, it's fully capitated here. But the fee for service is the one that will allow them to make the changes accordingly.
Got it.
You know, with the individual charges, that however whatever exceptions they need for each one of the charges.
Perfect.
Yes, and so then also, so you would create this fee for service and the capitated. The only difference between the other fee schedule, the one fee schedule, here is a percent fee for service, is that you have to have just a plain fee schedule already associated. So I already created one, and I'm just going to call it a Chiro test so that you all can see. And then if I associate a percent, like I want to take a percent off, maybe 15%, which it would being generous. And then you want to have just a plain fee schedule, which is the family discount plan, is what I named it. It's just a copy of your fees, of all of your charges, no changes to them or anything like that, just a straight copy. And this will allow you to discount those charges at whatever percent that you're looking to do it at. So if I said 15% discount, I put in the 85%, it gives me the $6 off the $40, as you can see right there. So that's
Well,
all 3 schedules right here.
that is awesome.
And also in our community page, just to let you all know, if you forget any of this information, we have what you call handling discounts. That's a good article, and it gives 3 different, ways to handle your discounts, which she talked about both ways, fee schedules and the care packages. And then we have a couple of other articles, the benefit of a fee schedule, and which, we went over today. And then understanding the different fee schedule types. So sometimes we don't understand the different ones, which she talked about as well, which is the percent off for those, for those different plans, and then the capitated one for, maybe the choose a plan or something like that.
So let me ask you this, Felicity. Is there can you go back to I believe you were in the chiropractic cloud community, right?
Yes.
Okay, so is there a place in there where there are going to be the recorded webinars?
Yes. They'll probably add the link, probably here on the front page here.
Home screen?
And
Okay.
and where we have the register for the webinar here, they'll probably have a link for the copy it right here.
Yeah, we don't have any recorded webinars up yet, folks, but this will be the very first one. So I want you to know where to go so you can find it within your cloud community there. So that's really exciting too. I'm excited about that.
Yes.
Kathy, I'm going to actually use this as just take a break in the action just for a second. I want to put up a poll, folks. Obviously, most of you probably know about Kathy and her team and their services. For those of you who may be hearing about this for the first time, just in case you'd like to engage those services and you have some interest in them, I'm just going to throw up a poll so you can go ahead and give us that tell us how you feel about it. And if you'd like to have somebody over from KMC University reach out to your office and explore how they can help you become more efficient, make more money, and just overall do a better job of caring for your patients, they'll have somebody reach out.
Set a time to dig into one of these questions. chiropractic users, even as not a member, can utilize one of those quick consultations at a discounted fee. So if all you need to do is dig into something, we'll give you 15-20 minutes and we'll take care of it a la carte, no problem.
Yeah, no, someone from their office will call. So warn your front desk that they're not just the general phone solicitors, because a lot of times they'll call, and if the front desk hasn't been warned, they're obviously going to deflect them into the corner. If you're a hockey fan, you know what I'm talking about. But so be nice to them when they call. A lot of times when they call, people don't expect that they're calling and treat them, well, like random cold callers, and that's not what they are, because you're expressing interest right now. So as soon as I get 50% of you to vote, I'm at 30% now. As soon as I get 50% of you to vote, we'll go ahead and take this poll down.
Clearly,
so
you can say no. So just say no if you want to,
yes,
so we can move on and get back to questions, please.
Exactly. And we'll get back to questions anyways. I'm not going to, we're at 50% anyways, but thank you so much for participating. My last call on questions, and let's get some more questions from you.
Yeah, I'll answer Jenny's question. Must we bill insurance if they tell us they have insurance but don't want to use it? So in 2013, the HIPAA omnibus laws were changed, and patients received unprecedented rights to direct providers as to whether they could or couldn't bill their insurance. A lot of doctors tend to go wrong by telling a patient, we don't bill insurance. If you come here, you can't use your insurance, even when they're in network. And that's where we don't want to manage that. So the best way to do that is to let them know that in your compliant HIPAA program, if you've done HIPAA properly and kept it up to date, you should have a form there that is a restriction of their PHI, protected health information. They have to sign that, and they have to direct you not to bill. And if they do, then Katie bar the door. Do not ever bill their insurance until they come back and tell you that they want to undo that, because now that would be a violation of HIPAA if you did bill it. Now, again, if it's their idea and that's their request. That's how you manage it. And then I think they're going to show Carrie again what we were
I'm going to
pointing
grab this
to
question.
about watching the recording.
Yeah, so I think the screen is still up, Carrie. There's likely to be a button added to this screen, which will take you to a bank of all the webinars we do with respect to the cloud products, CT Advanced and CT Core. So we're not just going to put that webinar up here and then it's going to get replaced by the next one. It'll be the first entry in a bank of webinars. So and those will live there in perpetuity up and into the point where probably years from now they'll be replaced by a similar one when they're no longer timely rather. They're probably going to still be relevant, but they just won't be timely. So that's a great question. And for those of you that are cloud users, you'll start to see more and more of things like this being added. Not only informational training types of webinars, but also just industry relative webinars, presentations by other folks in the industry who are talking and telling us about and how to do all sorts of things to make our patients' lives better. And our lives better in return as a result. So, yeah. Well, this is really awesome. We've still got looks like maybe about 2 or 3 more minutes. If you have any other questions,
Here's one.
looks like Stephanie has one.
Yeah. If I am not in network and the patient pays out of pocket and I provide a super bill, does that last comment apply here? So I don't know if you're talking about the question that Jenny had regarding a patient directing someone not to bill their insurance. Okay, so if you're not in network and your policy is that you do not submit, which is 100% what we recommend, if you're out of network, don't submit on the patient's behalf because that is drawing you into all the rules and all those crazy things. If that is the case, then you are just simply, insurance doesn't exist there. So you're just simply providing a receipt. They'll submit it if they want to. They've paid you. All is well. Just don't submit on their behalf. And Jenny, you would have to look into your compliant HIPAA program, and there should be a set of forms that go along with every promise that you make in your notice of privacy practices. And almost everything you say there has a corresponding form if your program is doing what it's supposed to do. So that's where you would find that form. And it's actually called exactly that, restriction of PHI.
Okay. All right. Last question of the day is going to be from John. And he says, can I treat a Medicare patient if I do not participate as a Medicare provider or a non-PAR?
John, what that means is you're not properly enrolled in Medicare Part B. So whatever state you're in, there's a designated Medicare administrative contractor that handles Medicare Part B. Then you know what that is in Illinois. By law, you can't touch them. You cannot touch a Medicare patient without being enrolled. Now, Medicare Part C runs a little bit different. This is a very, very advanced question. It's a very basic question that has been around since the dawn of Medicare, that a chiropractor can't opt out. So no, you cannot touch them. But Medicare Part C has some different rules, and about 60% of your patients are now Medicare Part C. So you have to be aware of that. We work with doctors all the time who are in this situation. They want to fix it, and it's not hard to fix. 10,000 people to 11,000 people per day age into Medicare. So if you're not enrolled in Medicare, your population of patients is going to have to get referred out. So I urge you to please fix it. Please, please. We'd love to help you. It's not hard. Just fix it. It's basic.
All right. Well, hey, that brings us to the end of our webinar, folks. I can't thank you enough for coming. We'll be, I guess Kathy, you tell me, I'm kind of out of the loop on that, but are we doing these once a month?
My understanding is they're every other month, in between the ones for the server users. And the next one then would likely be in April, and you might get me or you
Great.
might not get me. I'm not sure
Yeah.
because I'm going to be in South Africa for a long time in April, so you might get one of my team. I have to jump to another call right this minute,
Perfect.
but
Well,
I will answer. Valerie, please don't hesitate to reach in with that one.
thank you so much, Kathy. We appreciate you. We love you. Have an awesome day, okay? So Kathy's gone. Folks, we're going to sign out. I just want to thank you so much for coming. Felicity, how you doing out there? You hanging in there?
I'm hanging in there. Thank you guys for coming. It was a very great webinar. If you guys need any assistance, please don't hesitate to reach out to support for assistance with setting those things up in your software if you need assistance with that.
Yeah. So and today was Felicity's first webinar ever, folks. So I know I'm giving her a big round of applause over here because I can't do it myself. That's for sure. With that being said, look forward to another Cloud CurryTouch KMC coding, billing, and compliance webinar in about 2 months. And I just hope you guys have the most outstanding day. Tuesday, let's talk about weather. Whether or not you're going to enjoy yourself. It's up to you because only you can enjoy your life. I hope you have a wonderful day. Hope you have a great week. Stay healthy, keeping people healthy, and be kind to one another. We'll talk to you later. CurryTouch signing out.